We are live now.
Okay, ma'am. Okay. Manju, we are live. A very good evening to all the eminent doctors. Thank you so much for joining us for today's webinar. Our endeavor is to spread awareness about rabies, which is fatal but cannot be avoided once appropriately vaccinated. So this is an initiative from Cadila through this innovation to serve the society and humankind. The topic of the webinar is novel 3-dose G protein vaccine, ultimate key for the compliance. Dear doctors, rabies is the world's first 3-dose anti-rabies vaccine, and with great pride, we would like to inform you that rabies has successfully completed 1 year of launch, with more than 40,000 animal bite victims being vaccinated. 100% compliance was recorded and no case of adverse was registered. With this, it is my honor to introduce you to the speaker of today's webinar, Dr. A.S. Singer, sir. His specialty is MS surgeon. He is a very senior doctor of our Kanpur headquarters, and he's running his own hospital, Anurag Hospital, and his total experience is more than 30 years. So very senior doctors he is. So now I would like to request Dr. A. Singer, sir, to initiate the talk, and later we will have a question and answer session. So all the participants can drop their questions in the drop box, and we will read out all the questions after the presentation. So, sir, over to you, sir.
हेलो निखिल, आवाज नहीं आ रही है. हेलो.
यस मैम। हेलो।
हाँ,
अभी आ रही है?
अभी आपकी आवाज आ रही है मुझे.
ओके मैम,
हाँ
आप सर की आवाज है।
तो पहले पीछे
हाँ
का
हाँ, अभी सही है. अभी एवरीथिंग इज फाइन.
ओके मैम।
current management is local wound treatment, first aid, active immunization, that is vaccine, and passive immunization, that is rabies immunoglobulins. 5-dose essential intramuscular regime. Current challenge of post-exposure prophylaxis is non-compliance, and current rabies vaccines are cell culture vaccine, CCV, and inactivated vaccines are more than 50 years old technology. Compliance anti-rabies vaccine. Complaint: who received the full course of ARV, that is the scheduled dose of ARV on the recommended dates. Delayed complaint: who completed the scheduled dose of ARV within 60 days but deviated from the scheduled regime. Dropout, non-compliant: who had taken a dose of ARV after animal bite but not completed all the scheduled doses. Next. Rabies post-exposure prophylaxis in routine practice in view of the new Centers for Disease Control and Prevention and World Health Organization recommendations. limitations to 4-dose WHO recommendations. A retrospective analysis done at Travel Clinic, total number of 110 patients who received rabies 4-dose post-exposure prophylaxis. Shortcomings in the management of these patients were late intimation of rabies, PP travelers, administration of human rabies immunoglobulins and antibody levels, non-compliance to 5-dose proven cause of death. These are the case analysis. 50-year male female patient only taken 3 doses of purified chick embryo vaccine. The reason of deaths may be due to lack of administration of rabies, immunoglobulins, or poor compliance to the vaccine. All these 3 cases expired due to encephalitis, rabies encephalitis. Original article, compliance to post-exposure prophylaxis among animal bites, a hospital-based epidemiological study. At Safdarjung Hospital, New Delhi, 360 animal bite patients, a pre-designed, pre-tested, structured questionnaire was administered by the interview technique. 53% were non-compliant to the full course of ARV. Compliance to anti-rabies vaccination in post-exposure prophylaxis. Constraint for the compliance to complete course of anti-rabies vaccine interferes with the school timing 11%, distance of the hospital 11%, cost incurred 13%, forgotten dates 18%. These are the category name percentage wise. The major constraints for the compliance to complete ARV was loss of wages 47%. Evolution of rabies vaccine by nervous tissue and cell culture. In nervous tissue, live attenuated vaccine, spinal cord, and inactivated vaccine, brain up to 10%. In cell culture, inactivated vaccine, cell culture, and more than 2.5 IU. In 1885 and 1911, then 1976. Non-compliance led to the evolution treatment of regime from 31 dose to 5 dose and still now. Meeting the unmet medical need, introducing a novel vaccine with simple shorter regime. Novel 3-dose recombinant rabies G protein vaccine. This first vaccine with 3-dose intramuscular regime 0, 3, and 7 days. Better compliance due to easy to flow regime and less visits. Convenient, ready to use, no reconstitution needed. Prepared by VLP platform technology and first protein subunit vaccine. Novel 3-dose recombinant rabies G protein vaccine. VLP technology, native virus, G protein difficult to stabilize, G protein isolation using VLP technology, purified and stabilized by Cadila Pharmaceuticals Limited. VLPs are similar to native virus particles, but that too not contain the viral genome. Virus-like particles, VLP, are protein complexes exist as nanoparticles. They cannot replicate but can mimic the viral antigenicity without being pathogenic. They are capable of inducing strong humoral and cellular immune response. VLPs as vaccine. Study design 0 to 3, 2 dose, 0 to 0, 3, 7, 3 doses, 10 microgram to 50 microgram, seroprotection data. Clinical study phase 3. safety and immunogenicity of a novel 3-dose recombinant nanoparticle rabies G protein vaccine administered as stimulated post-exposure immunization, a randomized comparator controlled multi-center phase 3 clinical study, human vaccines and immunotherapeuticals. Phase 3 study to evaluate immunogenicity and safety of rabies G protein vaccine administered as a simulated post-exposure immunization in healthy volunteers, randomized comparator controlled multi-center study, total subject 800 randomization, rabies 0-3-7 days regime compared to 0-3-7-14-18 regime. 533 subjects. Results, efficacy. The results were consistent across different age groups and genders. Observed difference 1.52, that is 95%, with the pre-specified margins of -4%. Non-inferiority of the seroprotein primary endpoint days 14 and 42 were met. Test and comparator are identical in the seroprotection rate both on day 14 and 42. Novel 3-dose has better safety profile as significantly less AEs compared to reference vaccine. Next. Study conclusion. Novel 3-dose was non-inferior to reference vaccine, less adverse effect compared to reference vaccine. Novel 3-dose was found to be safe and immunogenic and was comparable to 5-dose of WHO pre-qualified vaccine. So this vaccine also has been given awards by Pharma Innovation of the Year, by the Economic Times, and also by the Golden Globe Tigers Award, Malaysia, for Innovative Products of the Year. So in my opinion, rabies vaccine for the rabies is at present time is the best for the immunization of the post-prophylaxis cases of the rabies. Dog bite, I have given so many patients of ours. They showed no side effect and very good compliance, because 0, 3 and 7 days regime is very acceptable and cost effective also, and they no side effects. My experience is very good in this vaccine. Thank you.
Thank you so much, sir, for your innovative talk. We truly appreciated your effort. Last but not the least, we would like to inform you that Travis has won the prestigious award in innovation category, that is
Hello.
Yes, ma'am.
Sir, I would like to thank Doctor for this wonderful slides which he has shared and the conversation he had. There are few questions in the chat box which I would like sir to address.
Just one minute, ma'am. The voice is very slow. Just 1 minute.
Okay, okay. Sir,
Yeah, ma'am. Sir is there. So, oh,
sir, first thing is that there is a very common question that what are the symptoms if somebody is having rabies? Initially, symptoms kya hote hain? That is very common question which is being asked.
First, most symptom is hydrophobia, that patient fears from the water. As soon as he or she see the water, then he fears to take the water. Main symptom.
Okay, sorry, sir. I got a call in between. So this is one first question. The second question is that if 5 doses vaccine somebody has taken and they have completed only 3 doses, then there are possibility that they can get the rabies infection after they can get the symptoms after 3 months or
Ex-
6 months. Like any chances are there like that if the doses are not complete course is not completed.
If complete course is not given,
Yes,
then there are chances of occurring disease in the future dates.
okay, okay. So, in your experience, or any of your patients, or your any practice which you have seen the patients, which you can share with the people, because right now I can see almost 80 plus participants are there. So, I just wanted to share your experience of rabies or any other rabies patient which you have seen, which you can share with the participants who have joined. Your experience of rabies treatment vaccination.
So this vaccine is no doubt it is very good as compared to the previous 5 doses vaccine. So I think it will be better at present.
so sir,
Okay.
just please share your own experience
Regarding
regarding rabies.
no doubt, it is better. It is best at present.
Thank you, sir.
Okay.
Okay, thank you so much, sir. Right now, the slides which you have shown are very much clear. Right now, we don't have any questions also. From Cadila family, we are thanking you for being part of our previous webinar. I would also like to inform you that right now we are having almost 50 plus webinars at the same time and with
Okay.
almost 50 different speakers. And we are aiming to make India rabies free. That's why we are taking this initiative. And almost 1 year we have completed almost 40,000 patients we have vaccinated. So this is a Cadila initiative to make India rabies free. So we are continuing this education program also, and we are also sharing the posters to generate awareness, like what are the immediate things which are to be done once you are getting any dog lick or any bite. That too in regional languages. So we are creating that noise in the market regarding the rabies.
So
And thank you, sir,
it's
for being.
very good mission
Yes,
started by Cadila. So for the
yes,
human being, because the disease is very fatal. Once it occurs, there is no treatment at present. So
correct, sir. Prevention is better than cure.
prevention is better than cure.
Yes, sir. Yes, sir. Thank you, sir. And I would like to thank all the doctors also who have taken their time to attend this webinar, and also lots of queries have been asked and that has been already cleared by doctor. So thank you so much, sir. Thank you all the doctors who have joined. Thank you, Nikhil, for conducting this program.
Thank you.
Okay,
Thank you.
Okay. Thank you. Thank you, sir. Good day, sir.
Good day.
Thank you, sir.
Text support we can.
Yes, ma'am.
Text support it is done. We can close the session.
Just, ma'am, just 1 second. I will call you.
Okay, okay. Hello, tech support. Please end the session.
Okay, ma'am.
Hello.
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 Hello. Yes, ma'am.
Hello, tech support. Please end the session.